Many people try smoking out of curiosity. It's human nature to wonder about things we don't understand, and cigarettes can seem like a mysterious object, especially when they're off limits. The allure of the unknown can be strong, tempting us to explore even when we suspect there might be risks involved, or to fit in with friends. The desire to belong is a powerful motivator, particularly during adolescence. When your friends are doing something, it can feel incredibly difficult to resist the pressure to join in, even if you know it's not the best choice for you. It can seem cool, a way to project an image of confidence and rebellion. Or grown up, a shortcut to appearing more mature and sophisticated than you actually feel, especially when seen in movies or among adults. The media often glamorizes smoking, portraying it as a symbol of independence or worldliness. Seeing admired figures smoking can create a false impression of its appeal. But that first cigarette, that initial experiment, is a risky step toward a dangerous habit. It's a doorway that's easy to walk through, but much harder to turn back from. The first puff usually feels awful, a harsh, burning sensation that assaults your senses. Coughing, dizziness, a wave of nausea that makes you question why you even tried it in the first place, and a bad taste. An acrid, lingering taste that coats your mouth and refuses to go away. The strong smell clings to clothes, permeating every fiber and announcing your experiment to the world. And the body reacts with clear warning signs. It's your system's way of saying, this is not good for you. Our lungs are meant for clean air, for the refreshing feeling of a deep breath of fresh air. Not smoke filled with chemicals, a toxic cocktail of substances that damage your delicate respiratory system. Coughing, a violent expulsion, is the body's way of rejecting something harmful, a desperate attempt to clear the irritants from your airways. Despite the unpleasant experience, the initial discomfort and the obvious warning signs, some try again to fit in or seem tough, succumbing to peer pressure, or the misguided belief that it makes them look cool. Each cigarette makes it easier to continue, each puff desensitizing you to the negative effects and strengthening the psychological connection. And that's how a habit forms, slowly but surely, until it becomes an ingrained part of your daily routine. This path leads to serious health problems over time, a future filled with increased risks of lung disease, heart problems, and other debilitating conditions. The smartest choice is to listen to your body, to heed the warnings and recognize that smoking is never worth the risk, and not try again, to resist the temptation, to stand strong against peer pressure, and to protect your health. That first decision, that initial choice to pick up a cigarette, can shape your future health, determining whether you enjoy a long, healthy life or struggle with the consequences of a dangerous habit. Remember, as you navigate these choices and face these pressures, saying no is always the wiser move. It's an act of self-respect, a commitment to your well-being, and a step towards a healthier, happier future. Nicotine, a chemical compound naturally found in tobacco plants, is the key ingredient that makes tobacco products so addictive. It's a powerful stimulant that affects the brain and body in numerous ways. Understanding its chemical structure helps us appreciate how easily it binds to receptors in the brain. When tobacco is smoked, nicotine is rapidly absorbed into the body. It quickly enters the bloodstream through the lungs. From there, it's carried throughout the body, reaching the brain in a matter of seconds. This rapid delivery is a major factor in its addictive potential. Once in the brain, nicotine triggers a cascade of neurochemical events, most notably the release of dopamine. Dopamine is a neurotransmitter associated with pleasure and reward, creating a brief feeling of pleasure, relaxation, or calm. This is what makes people want to keep smoking. But this feeling is fleeting. It fades fast as nicotine levels in the blood drop. As the pleasurable effects wear off, the brain craves more nicotine to restore those feelings. That's how the cycle of addiction starts, a relentless pursuit of that initial dopamine rush. Individuals find themselves compulsively chasing the next hit to avoid withdrawal symptoms and recapture that fleeting sense of well-being. Beyond its effects on the brain, nicotine also has significant impacts on the cardiovascular system. It speeds up the heart rate, putting extra stress on this vital organ. Furthermore, nicotine raises blood pressure, further increasing the strain on the heart and blood vessels. This combination of increased heart rate and elevated blood pressure forces the heart to work harder than it should. Over time, this constant strain can lead to significant damage to the heart muscle itself. Nicotine also damages the delicate lining of blood vessels, making them more prone to plaque buildup. As a result, blood vessels narrow, restricting blood flow to vital organs and tissues. This narrowing significantly increases the risk of developing heart disease, stroke, and other serious cardiovascular problems. When someone tries to quit, withdrawal symptoms like irritability and difficulty concentrating can be intense. The anxiety and discomfort associated with withdrawal make quitting incredibly tough, even for those who are highly motivated. Smoking again provides temporary relief from these unpleasant feelings, reinforcing the addictive cycle. This creates a powerful association between smoking and feeling better, further solidifying the habit. Over time, the body and brain become physically and psychologically dependent on nicotine. The body craves a regular supply of nicotine to function normally, leading to a persistent urge to smoke. This cycle of craving, relief, and dependence is incredibly hard to break, but it's not impossible. Understanding the mechanisms of nicotine addiction is the first and most crucial step towards breaking free. The quick pleasure and temporary relief that nicotine provides simply isn't worth the long-term risks to your health and well-being. When you light a cigarette, you're not just inhaling tobacco. Cigarette smoke is a complex cocktail, a swirling cloud of unseen dangers. It contains over 7,000 chemicals, at least 70 of which are known to cause cancer. These aren't just minor irritants, they are potent carcinogens that attack your body at a cellular level. It's not just tobacco and nicotine, it's a toxic mix of compounds, many of which are industrial chemicals with no place inside the human body. Tar, that sticky brown residue, coats the delicate lining of the lungs, making it increasingly hard to breathe with each cigarette. It's like paving your lungs with asphalt. Carbon monoxide, the very same poisonous gas found in car exhaust, reduces the amount of oxygen in your blood, starving your vital organs. And then there's arsenic and formaldehyde, poisons and preservatives used in industrial processes, that are also inhaled with every puff. These are not ingredients for a healthy life. These chemicals don't just stay in your respiratory system. They travel from the lungs, directly into the bloodstream, reaching and affecting every organ and system in your body. Smoking damages not just the lungs, causing chronic bronchitis and emphysema, but also the heart, increasing the risk of heart attacks and strokes. It even affects the brain, increasing the likelihood of cognitive decline and stroke. Smoking prematurely ages the skin, damages your teeth and gums, and impacts nearly every aspect of your health and well-being. Each puff adds more toxins to the mix, slowly poisoning the body from the inside out. The harm builds up gradually over time, compounding with each cigarette smoked. Often, the damage is happening silently, even if you don't notice it right away. The body valiantly tries to fight back against this constant onslaught of toxins, but eventually, the sheer volume of harmful chemicals overwhelms its defenses. The longer and more frequently you smoke, the greater and more irreversible the damage becomes. No part of the body is truly safe or immune from the pervasive reach of these harmful chemicals. That's the stark and unsettling reality, the real danger lurking behind every seemingly harmless cigarette. Smoking's effects show up quickly, even before serious diseases develop. Bad breath and the smell of smoke on clothes are early signs. Smokers often develop a persistent cough as the lungs try to clear out tar. More phlegm, shortness of breath, and trouble with physical activity follow. Teeth and fingers can become stained, and skin loses its healthy glow. Smoking reduces blood flow, leading to dull skin and early wrinkles. Taste and smell fade, making food less enjoyable. Smokers get more colds and infections because their immune system is weaker. These are the body's early warnings, signals that something is wrong. Ignoring them can lead to bigger problems down the road. The body is asking for a change. Paying attention to these signs can help prevent long-term harm. It's never too early to listen and act. Smoking is a leading cause of preventable death and disease worldwide. The longer and more you smoke, the higher your risk. Lungs suffer first. Chronic bronchitis, emphysema, and lung cancer are common. Tar and chemicals destroy lung cells, making breathing difficult. Heart disease and stroke are also major risks. Smoking damages blood vessels, thickens blood, and increases clot risk. Clots can cause heart attacks or strokes, sometimes with fatal results. Smoking raises the risk of cancers in the mouth, throat, bladder, and more. Harmful chemicals travel through the bloodstream, damaging organs everywhere. The immune system weakens, making it harder to fight off illness. The impact is body-wide and life-shortening. The risks are real and preventable. The best news? The body starts healing as soon as you quit smoking. It's never too late. Quitting brings health benefits at any age. Within 20 minutes, heart rate and blood pressure begin to drop. In 12 hours, carbon monoxide levels fall, letting more oxygen reach your cells. Circulation and lung function improve within weeks. Breathing gets easier, coughing lessens, and senses of taste and smell return. Energy increases, and physical activity feels easier. After a year, heart attack risk drops by half. 5 to 10 years later, stroke risk can match that of a non-smoker. After 10 years, lung cancer risk is cut in half. The body's ability to recover is remarkable. Every day without smoking is a step toward better health. Quitting is the most important choice for your future. Quitting smoking is a powerful step toward a healthier, longer life. The benefits go far beyond avoiding disease. More energy, better taste and smell, and extra money are just the start. You protect loved ones from secondhand smoke too. Support is available. Doctors, counselors, and quit lines can help. Nicotine replacement and medications make quitting easier. It may take several tries, but every attempt brings you closer. A smoke-free life means more freedom and better quality of life. Imagine breathing easier, feeling stronger, and enjoying life more fully. The rewards are real and lasting. Your body and future self will thank you. Choose health. Embrace a life free from tobacco. Subscribe this channel.